to eliminate health disparities and make Travis County a model healthy community. It is our responsibility and our commitment to address challenges around healthcare access for Travis County residents with low income and no insurance. So all of us here today and always pledge to listen to you and engage with you. We want to assure you that we are committed to creating an atmosphere of respectful dialogue, and we ask that our public meeting attendees join us in this commitment. We are committed to showing respect to each other and supporting productive dialogue and, yes, often discourse during these meetings. Now, if a question comes up during our presentation, we would invite you to please drop it in the Facebook comments so that we can address it either live during our Q&A portion towards the end of this meeting, or we will, if we can't get to your question, or perhaps we don't have the answer immediately at our fingertips, we will definitely address all questions and send those to all the participants who've RSVP'd in a follow-up email, and we will answer these in the Facebook Live section that will live on our Facebook Live platform. Now, with those messages out of the way, we do want to thank you again for joining. It's our honor to be here with you and to share information about this incredibly important project. Today, you're going to hear more about our progress towards an equity-focused systems planning initiative and our voice of the community engagement component of this initiative. Then we'll open it up for questions. Central Health is leading an initiative to create a high-functioning, patient, and equity-focused healthcare system that will improve the health of our entire community, but most importantly, the people who we serve, people who are uninsured or underinsured. Central Health is the Travis County Healthcare District, serving about 1 in 9 Travis County residents. But before we begin the presentation, we would like to watch a short video to tee up our conversation.
Here in Austin alone, we have people in some zip codes that live 10 years longer than people in some other zip codes. We cannot call ourselves a healthy community as long as we see those kinds of disparities.
Central Health has launched a planning effort that will transform how healthcare is provided and improve the lives of everyone in Travis County.
Created by Travis County voters in 2004, Central Health is the healthcare district for Travis County. Part of our statutory mission is to provide access to healthcare for those that need it most. But we also want to challenge the status quo. And we know it's important to step back and through an equity lens, look at these systems of care to make sure that they are the best that they can possibly be.
Equity is about fairness. It's about justice. It's a principle that says we value everyone equally. No one is more important than anyone else. So if we apply that to health, people's physical, emotional, and social well-being, systems planning gives us a chance to take care of people across a lifespan. And rather than dealing with episodes, what it lets us do is think about people from the perspective of prevention, from taking care of conditions that they have, from improving them all the way down to comfort.
Now, this work is not entirely new to Central Health. In fact, for years now, Central Health has been putting the building blocks in place, specialty care, primary care, new clinic sites. We're just simply taking everything to the next level.
Removing barriers to care, providing increased access to care, and access to quality care rapidly increases patients' health equity.
Within Central Health, we are a team of case management specialists that identify complex patients in different settings, mostly within the hospital setting.
Our team navigates patients through the transition into healthcare outside of the brick and mortar building. Our case management team makes sure that when a patient left the hospital, they had an appointment scheduled, they are connected to their medical home, and ensure they're able to get to and from their appointment. I can see systems planning expanding our teams in a way that we have more reach. We would be able to make sure that we can send a patient to a specialist and there will not be a wait list. We will make sure that these patients can get the access and care that they need so they don't end up back in the hospital.
The systems planning effort for us is a great opportunity. It allows Central Health to take a step back, take a full view of the system, do deep dives into the different components of our system. We identify gaps and then we prioritize those gaps. And based on those priorities, we'll be able to lay out a blueprint of the work that Central Health needs to do over the next 3, 5, or 7 to 10 year time frame.
Once we have that blueprint and the Board of Managers adopts it, we'll figure out how to turn that plan into a reality for our community and how to fund that reality for decades to come.
I have the privilege of working with the operations team that's going to help make this plan a reality by working with existing partners as well as forging new paths with new partners.
Building comprehensive programs really requires a year-over-year effort. Things like bringing dialysis to our patients for the first time. Dialysis has typically not been available to our patients in an outpatient or home-based setting.
We're again removing a barrier to care. We increase their opportunity to succeed, therefore advancing health equity.
So we're getting closer to where we want to be. And I think our patients are really appreciative of that. About 13% of the population in Austin has diabetes. Patients who come to community care actually have a really wonderful collaborative care team environment.
Hi, my name is Selena Ramos. I am a mother of 3. My blood sugars were everywhere.
Diabetes care is really a team sport. So the patient starts getting education from the minute that they enter the clinics. They may spend some time with a clinical pharmacist or a registered dietitian. They have a whole group of people who can really wrap them in care, and that helps them stay healthy.
Now I have all these things going on. People who actually care. You know, I actually have doctors that will talk to me like I'm a person. I feel like I have a higher quality of care because of that.
What is it that we can do to make the systems of care better, to have equitable outcomes for everyone? And that's what we're aiming to do with the systems-based initiative. Taking the lead on the design and working with our partners, community leaders, advocates, that's what we want to bring to Travis County.
Once we built a high-functioning, comprehensive healthcare system, the patients that we serve will be able to focus their energy on getting better and feeling healthier, and trust that the system that we built will be there to support them in that work.
And now, excuse me, now I'd like to turn the presentation over to Monica Crowley, who will provide an overview of how Central Health is building a better healthcare system for Travis County. Monica?
Thank you so much, Ted, and thanks to your team for that, very clear introduction video. We are all excited to be here with you today, sharing this effort that Central Health is undertaking to lead the development of a comprehensive, high-functioning, coordinated healthcare system for people with low income in our community. As the hospital district with the legislative and voter-determined responsibility to ensure the provision of, and that is also responsible for coordinating the delivery of healthcare services for people with low incomes who live in Travis County, Central Health is the only organization, whether governmental or private, with the mission and obligation to look across every part of the safety net healthcare system and determine which needs exist, to reach out to the community to determine what needs people are seeing in the communities that we serve and should be serving, and how we are meeting those needs, what gaps exist, and how addressing those gaps should be prioritized. This work is a key aspect of Central Health's mission, which is rooted in addressing systemic healthcare inequities that disproportionately impact the residents of Travis County we serve or should be serving. A brief background on this systems, equity-focused systems of care initiative. Last year, in recognition of how fragmentation in our health systems in our communities leads to gaps and access shortages in primary, specialty, and behavioral health care, and disparities in the prevalence of disease, particularly in the most marginalized communities in Travis County, the Central Health Board prioritized a multi-year effort to ensure that complete care pathways become available to low-income residents of Travis County to improve clinical outcomes, to reduce mortality, to improve health equity, and to improve quality of life. Last year, we completed the first two major pieces of this work, and the timing for bringing the slides back up, I think, is going to be...
It's coming, Monica.
It's coming. I was going to say, I think it's almost perfect because we're ready for the next slide with the cogs, please. Perfect. Thank you. This slide depicts one of the first parts of this work that we took on last year, which was working with partners and subject matter experts to identify an initial draft of components of what might be in a comprehensive high-functioning system. And that's what's displayed in this slide. Each cog represents both physical and mental health, because both of those are part of a comprehensive health and healthcare experience. And it represents a non-connected system. Now the cogs are separate to demonstrate how today many of these cogs do not interrelate here in Travis County. And central to that main cog, in addition to the external cogs that depict areas of population health and wellness and prevention and social determinants, primary care, both behavioral and physical, specialty care, hospital care, and post-acute care, there are central services that include navigation, electronic health records that speak to each other, data transparency, payment coverage, and also social determinants of health, again, in the center, along with care coordination, eligibility services, and integration of people being able to schedule appointments across the system. Those central cogs are components that increase success in helping patients get the care that they need and interact with each part of the system and move between different parts of the system. Also, last year, we collaborated across the organization and department and with other subject matter experts to identify and evaluate immediate gaps using a number of prioritization factors that we shared during community conversations last year, particularly when we were going through our budget development, that identified the fiscal year 22 service delivery strategic priorities that we brought to you through these community conversations, and that the board adopted as part of fiscal year 22 budget priorities. Next slide, please. Now we are in a phase of this equity-focused systems work where we have engaged Guidehouse and case strategies, which you'll hear in a few minutes from Will Murphy, who's been working with us on the Voice of Communities from case strategies. These are healthcare planning and community engagement experts that are working with us to reach 3 major objectives right now, and that are the main focus of this meeting today. And the first part is to develop a community health needs assessment that is focused on the current state of the safety net healthcare system in Travis County, and the gap and future needs for communities that we're currently serving and communities that we could and should be serving. The second part is a voice of the community, which Will is going to talk to you more about, that includes a community engagement strategy to understand the perspectives of our patients, providers, and community members, and also ensuring that hard to reach populations are included in our assessment of healthcare needs in our area. And then finally, this is going to result in the development of a service delivery strategic plan that the Central Health Board of Managers is going to consider and take recommendations on and adopt in the first few months of calendar year 2022, that will help us work over the next 5 to 7 years to build a comprehensive, high-functioning healthcare system that can improve the health of the people in Travis County that are eligible for Central Health Services. Next slide, please. This slide demonstrates progress and timeline for this phase of the work that I just described, that began in September of this year, and that will culminate in this board presentation and consideration of the service delivery strategic plan in the first few months of 2022. This timeline shows the different phases that went into this, or that are going into the development of this 5 to 7 year service delivery strategic plan. As we discussed in the slide above, this involves taking some time to assess needs and disparity in the communities we serve and could be serving both today and in the coming years. It also involves conducting extensive community engagement and input gathering as part of this needs assessment, which is taking place, part of that is taking place today. It also includes, and you can see the little red star for we are here. We're coming towards the end of a quantitative and qualitative gap assessment, which involves looking at the supply of services and doctors and types of services that are available today, and the level that we may need to either maintain today's levels or expand to meet additional need in the coming years. And it involves developing a way to prioritize how we address many gaps that have been identified, that also helps us identify areas, initiatives, investments that can have the biggest impacts across the healthcare ecosystem and in individual lives as we build toward this equity-focused service delivery strategic plan. Following this work in early 2022, with the Central Health Board adoption of this service delivery strategic plan, which will be our kind of roadmap, there's going to be an additional phase of the work that, in addition to continuing conversations with our community, will involve developing operational implementation and financial sustainability plans that also will include identifying our fiscal year 2023 service delivery priorities to help determine who will take on what role in addressing the identified gaps, how we will measure movement toward achieving our goals, and how to do this in a way that is financially achievable over the short, medium, and long terms. Now I'm going to hand over the presentation to JP Eichmiller to talk a little bit about preliminary. We don't have a final needs assessment yet, but we do have some preliminary information, and JP is going to describe the information that we have today. Thank you.
Thank you, Monica. Good morning, everyone. My name is JP Eichmiller, and I serve as the Senior Director of Strategy and Information Design for Central Health. I'm going to share with you a brief overview of the work Central Health does related to understanding the demographics of the communities we serve and how we use that knowledge to inform our planning efforts. If you could go to the next slide, please. So the systems planning work we are undertaking requires us to examine the geography of Travis County to help us gain an understanding of the varying needs of our local communities. So to help guide this effort, we've been working with our geospatial data analyst on our team to identify and divide Travis County into 14 what we call planning and assessment regions, which you can see identified on this slide. The boundaries of these regions is based on census tract analysis, as well as other characteristics, including geographic borders, the varying levels of urbanization, and population density, just to name a few things. So by identifying these 14 planning and assessment regions, we are able to use our own patient data in conjunction with public databases to really gain a better understanding of the health and accompanying social needs of our local communities. The early returns on the systems analysis is really helping to verify some of the trends we've identified previously through our biannual demographic report, as well as the other ongoing reporting that we regularly do. For example, if you look at this map and you focus on the I-35 corridor and the planning regions that cut north to south through the center of the county, we found that nearly 3/4 of all low-income Travis County residents reside in this area. So although we've often heard a narrative that a dominant eastern crescent of poverty has developed due to the high cost of living in Austin, the data tells us that 18% of the county's low-income residents live in the eastern portion of the county, and 8% of the low-income residents reside in the western portion. So what we see is a pattern where the large majority of low-income residents in Travis County reside in the multifamily housing units and manufactured housing communities close to the I-35 corridor. And while more and more middle and high-income families are relocating to the suburbs, it's exacerbating the housing challenges for our low-income residents. So rather than relocating to communities such as Pflugerville or Manor, for example, we're more likely now to see low-income residents moving out of Austin, being forced to relocate completely out of the county and into areas of Hays and Bastrop counties. We're also measuring trends in medical service delivery and enrollment for our health coverage programs. And this is providing us new understandings of where people from different communities are accessing services and where we might need to alter strategies for getting residents enrolled in our programs. What we have found is often the greatest need for services continues in the most densely populated low-income areas of Central Austin, such as Runberg, Montopolis, and Dove Springs. Our data shows us that residents from the rural and suburban areas are much more likely to receive care once they're enrolled than those actually living in urban areas with closer proximity to clinics. One factor we've hypothesized that may contribute to this is that we have data showing that residents in less populated areas are much more likely to have access to a vehicle. Next slide, please. If you're interested in learning more about our data as it relates to our patients and enrolled population, I invite you to check out our enrollment and clinical utilization dashboard, which I believe we will be sharing a link to. This dashboard is updated monthly and offers an interactive view of the demographics and geography of who Central Health enrolls in its programs, the patients we treat, and how that compares to the county's overall population. And this dashboard can be accessed by computer, tablet, or smartphone by following the links in the chat. And with that, I'd like to hand it off to Will Murphy to discuss the voice of the community communications, community engagement, and outreach tactics.
Thank you, JP. Good morning, everyone. I want to, there we go. The voice of the community is critical to understanding factors that influence patient access, connectedness, continuity, and trust, and improving health equity among some of our most vulnerable populations. We launched Voice of the Community, the community engagement component of Central Health Systems Planning Initiative, October 2021. The initiative started with focus groups dedicated to understanding the needs of the people. I'm especially proud of the inclusive, equity-focused community engagement methods our team and Central Health's team have employed. Next slide. This is how the voice of the community, actually my screen is showing a different slide. Can you go back one so we can show the people? Okay, no problem. This is how the voice of the community timeline intersects with overarching systems planning initiatives Monica talked about earlier. We spent months of the months of October and November holding community dinners and focus groups with advocacy groups, people with low income, and institutions. We also met with community advocacy groups to share information about the initiative, and we learned ways to better connect with those we serve currently and could serve in the future. We also conducted one-on-one interviews with people experiencing homelessness. The community engagement efforts have been focused around capturing the voice of the people with low income and partnering with the community organizations and advocacy groups to help us connect with people who are hard to reach. Next slide. We're going to talk a little bit about some of our tactics. This slide shows the many different inclusive, equity-focused community engagement methods we are employing with direction and support from Central Health Community Engagement Team. Our goal has been to involve residents with a primary focus on current and potential patients in this initiative, to inform and obtain feedback from consumers and patients. We rely on community dinners, in-person interviews, telephone interviews, and to inform and obtain feedback from the community at large, we rely on meetings with neighborhoods and advocacy groups, community conversations such as this one, and online surveys. A little bit more about some of our Voice of the Community efforts is here below. Next, listening to patients, staff, and vendors, inviting residents with low income to a community dinner at Dobie Early College Prep Academy, and to a community lunch at the Central Health Southeast Health and Wellness Center to hear about their experiences with healthcare systems. And over a catered meal, we had a great discussion. We offered transportation to and from these events for MAP and MAP Basic members. We also offered children's activities so that parents could bring their children and feel comfortable while participating. Each household received an HEB gift card in appreciation for their time. We then spent time talking to people that are often overlooked. At Sunrise Community Church, opened their doors and allowed us to use their space for one-on-one conversations with those experiencing homelessness. Participants received a Target gift card and HEB gift cards for their in appreciation for their responses to our questions and their involvement. Understanding how organizations help connect patients to better care, Central Health has been meeting with advocates and members of community agencies like Austin Asian Community Health Initiative, Community Coalition for Health, the Latino Healthcare Forum, Caritas of Austin, Casa Marianela, and many others. The Community Engagement Report, which will be published in January 2022, will include the complete list of organizations that we've talked to. We then spent time asking people of Travis County to get connected and get involved. In addition to Central Health has been sharing information on this initiative and ways to get involved during the community meetings, like the Colony Park Neighborhood Association, the Anti-Poverty Community Advisory Committee, the Del Valley Community Coalition, and the Central Health Equity Policy Council, and many others. The Community Engagement Report, again, will be published in January. Next slide. What you see on the screen are some of the pictures from Central Health staff that Central Health staff took at the in-person community dinners, where we connected with and learned so much about the people who live in Travis County and are potential and currently residents or potential patients of the system. Next slide. We've done community outreach as well, and here's some of the tactics. The Central Health Communications, Community Engagement, and Outreach team has been leading and supporting all these efforts. Some of the tactics they've used include grassroots outreach. Outreach staff, which include community health workers, have been teaming up with outreach partners, Latino Healthcare Forum, Community Coalition of Health, to get people with low income involved in our engagement activities. We've also used direct phone calls. Central Health staff has been literally picking up the phone to talk to MAP and MAP basic members regarding their healthcare experience. We've also used emails. Staff has been sharing information about the initiative and ways to get involved via email with more than 600 highly engaged individuals, including neighborhood association presidents, advocates, community health champions, and advisory committee members. We've used social media outreach. Central Health staff has been promoting every engagement event and activity through social media. Newsletters, we've used them too. Prior to any of our community conversations, we send email invitations to the list, and now have more than 6,000 contacts. We've also used paid social media campaigns. We're running a paid social media campaign while the online survey is live, and using geo-targeting for priority zip codes and people with low income. The campaign is both in English and in Spanish. Next slide. So what are our next steps? Well, the staff will continue conducting telephone interviews with MAP and MAP basic members through December 15th. The online survey will close December 23rd to allow us time to prepare the community engagement report. The link to the survey is on the screen, and the community engagement report, as we mentioned earlier, will be posted or be ready January 2022. Of course, staff are continuing community engagement efforts, and to schedule a time to meet with staff or to submit your questions or comments, please visit and participate in the centralhealth.net or use the website link. Visit participate centralhealth.net/voice of the community. We really appreciate everything that you've done so far and the people in the community for the work that we've been able to do in the voice of the community. Now, I'll pass it back to Ted.
Thank you, Will, for that update. Thank you to all of our presenters. We do have a few questions that have come in via Facebook Live that I want to get to. And we, again, are inviting anyone who is able to watch right now to please submit your questions. We're going to attempt to answer those for the next 20 minutes or so. And if we do not get to your question, or if we don't have the answer right now, we will be sending out a list of questions and answers to everybody who's watching. And we will also post those on Facebook Live. And this presentation will live on and remain on Facebook Live. Okay, so let me get to a couple of questions really quickly here. And I'm also going to invite other colleagues that are here with us on the line. I know we have from our outreach and engagement team, a couple of my colleagues who've been involved with Will on the voice of the community. One question that we had from a resident is regarding our service expansion. This person notes that asking about when facilities have been will be started and finished in the areas of most need, like Eastern Travis County. Specifically, he talks about Del Valley and the health disparities there. And I think this is a great question. JP, you talked about areas of need based on the data, based on the analysis that's been going on. But I thought it's a really timely question because we're sending out an email today regarding updates, with an update to service expansion in the Del Valley area. And so if Yvonne Davila is on the call, Yvonne, are you here with us?
Yes, thank you, Ted. Thank you
Would
so
mind?
much.
Go ahead.
Absolutely. So we have been working on two different sites in the Del Valley, in what people consider the Del Valley area, which spans from Hornsby Bend all the way through Creedmoor. That's the way most people in the community see the Del Valley area. So those two sites, one of them is in Hornsby Bend, and we're calling it the Hornsby Bend Health and Wellness Center. That's one project, and then the other one is the Del Valley Health and Wellness Center, which is more southeast, right? And we are dropping the links to each of these sites or projects on the Facebook live feed so that people can see more information, including a list of milestones. So every page has a list of milestones, and we have been sharing information with Del Valley and Hornsby Bend stakeholders. But in the fall, our staff went back to the board to ask for additional funding for each of these projects. As we all know, costs have risen since we first started working on these projects, right? So we went to our board in October to ask for additional funding, and that was done. And so that's one of the milestones. The other one was to have a construction contract awarded. And so the email update that we're sharing with the Valley stakeholders is that we have awarded a contract. We have executed a contract with a contractor for the Del Valley project, and we're in current negotiations with a contractor for the Hornsby Bend project. And so more to come on that one. The groundbreaking event is going to be determined based on the construction timelines that our contractors will have. And so we're waiting to have those kickoff meetings with the contractors to then have the conversations around the timelines for construction to then share with the community as well. And so that's the update on that.
Thank you,
If
Yvonne.
I may, Ted, if I may, just
Please.
a quick update on Hornsby Bend, and you didn't have the benefit of this information, and my apologies, but yesterday I signed the general contractor contract for construction for the Hornsby Bend site, so that contract has been signed.
Thank you, Mike.
Thank you.
And I would like to circle back, JP, because during your presentation on slide 9, I think there were some really enlightening points for all of us regarding the areas of greatest need for services. So as we continue to work to expand services in Eastern Travis County, as Yvonne and Mike mentioned, in Del Valley and Hornsby Bend, do you mind just perhaps reiterating, JP, what you talked about regarding those densely populated areas that are really along the I-35 corridor, and how that's going to help guide this strategic plan?
Sure, Ted. And first, I'd like to emphasize, I think it's the priority of this organization to try our best to ensure that no low-income residents are without access to quality healthcare, regardless of where they live in the county. But yes, to follow up on what you were referring to, while we have certainly been prioritizing making sure we are addressing some of the gaps in the outer rural and suburban areas of Eastern Travis County, we also need to be cognizant of the enormous disparities that still exist in the primary, central, and urban core. These are the areas where the vast majority of our low-income population lives, where the vast majority of our patients reside. And although if you were to look at a map of where our clinic system, where most of our clinics exist, which is in that central corridor, there is still much greater disparities as far as accessing, because we just don't we aren't up to the level we'd like to be as far as providing access in those areas.
Thanks, JP. And I thought one of the things that you also noted that was enlightening and eye-opening is based on the data that residents who are in the rural suburban areas in Eastern Travis County are more likely to receive care once they're enrolled in a health coverage program like the medical access program, perhaps, than those who are in those urban areas who actually live closer to clinics. I thought that was a really interesting point that has come from this analysis. I'd like to move on to some more questions, and I think there may still be some coming. We invite you to post your questions via Facebook Live, and we will answer them either now as time allows, or we will follow up with answers for everyone that's participating and post them on Facebook Live. But we have another question regarding mental health services, which is an issue and topic that is critically important to our community and to Central Health. But this person talks about NAMI Central Texas that provides peer support free services for individuals and their loved ones with mental health issues. And they would love to partner with us and provide services in our clinics. But perhaps, Monica, this might be a question for you just regarding, as we are doing this analysis, the role that the analysis is in fact not just covering primary care, specialty care, but also mental health services.
I had to
Monica,
unmute. Yes, yeah. Sorry, Ted.
No, you're
Unmuted. Great. And yes, we are. So thank you for posting from NAMI. And I know that in the past we have engaged with with folks from NAMI. And so I think we would love to interact with you more again. And we are evaluating as we look at the COGS, the mental and behavioral health needs as well as the medical needs. Would love to talk with community-based providers. I know that for this year, one of our Central Health Board priorities includes adding some peer support, particularly in the area of substance use disorder treatment. And so thank you so much for reaching out. And I think, Ted, how do people, contact, how would we get in touch with people?
We have everybody's contact information. We're going to share also a link. And by the way, NAMI is National Alliance on Mental Illness in Central Texas. And I believe we're going to share a link to the organization as part of this meeting, but also in our Facebook Live chat. Somebody, Yvonne, were you raising your hand?
Yes, we have a way for folks to get in touch with us, and we're dropping the link on the Facebook Live comment section. Thank you so much.
Yep. That could be a whole community conversation actually on its own, just new and enhanced ways to partner with Central Health. So thank you for the question, and thank you for sharing that. We have another question from one of our community partners. Is the community health needs assessment in conjunction with Austin Public Health's upcoming needs assessment, or is it separate? And I know, Monica, you can answer this question.
Absolutely. So we have participated in the CHA chip with Austin Public Health during the last CHA and the CHIP process. We're continuing to work with Austin Public Health, both on the steering committee and the data committees and the work groups for the current CHA and CHIP process. Our community health needs assessment is focused specifically on residents of Travis County who are under 200% of the federal poverty level, which we have not done this type of deep dive before, but we absolutely are sharing information with Austin Public Health as part of the CHA CHIP process and continuing to participate in that process as we do a deep dive and focus on the population that Central Health could be serving. That's a great question, though. Thank you.
Thank you, Monica. I should just add that we partner with Austin Public Health in many, many different ways. So not only on needs assessments, but also on community engagement, outreach, marketing, communication. So we really value the partnership that we have with Austin Public Health and Travis County. We have another question or a question from a resident and a member of one of our advisory committees asking how many people from the community have we met with. And I know, Will, as you mentioned, we will be publishing a complete list from our Voice of the Community activities in January. And so you'll see a comprehensive list of not only how many individuals, but also the organizations. But one of my colleagues did share just in person, the community dinner, community lunch, and we spent more than a half day at Sunrise Church. That was more than 100 people, and we're in the process of making phone calls, as Will mentioned. And so far, more than 120 phone calls, and the process continues. And I don't have the online survey numbers, but anyway, all of this will be published and shared. And of course, we will be able to answer any questions. And it's not too late to contact us if there's an organization or a particular individual that you think that we should be speaking with. We would love to hear from you. So thank you, Lorena. I have another question. I'm navigating a couple of screens here. This question, why are we still using gross income instead of net income when screening or enrolling patients? Using gross income leaves a lot of vulnerable people without health care. Do we have to follow federal poverty guidelines, or can Central Health make adjustments on how low income is calculated? And I don't know who might be the appropriate person to answer this question, or if we need to talk. Mike, I see you've unmuted.
Yeah, that is, first of all, that's a great question. Both the first and the second parts of it. And let me just say, then I'll defer to some of my colleagues to see if they have anything to add to this. But that is a big policy change in terms of the benchmarks that we use and the other metrics that we use to get people enrolled into the medical access program, both MAP as well as MAP Basic. And I think that's the sort of thing that there would need to be an analysis on. And there's some historical reasons for doing that, and also some functional reasons to make it, to try to not have as many barriers so that individuals can come in with the necessary documentations. And so there's a lot that has to be considered when you start changing what those enrollment criteria are. And then ultimately, that's the sort of thing that I would want to bring back to the board of Central Health, to the Board of Managers, because it is such a significant change. But nonetheless, that is a great question, and I'll see if my colleagues have anything that they want to add to that to maybe fill in some of the more finer points on answering.
Monica?
Yeah, I would just say I know many of the limits that we have on our enrollment guidelines are set by the Texas legislature. So there are set guidelines for programs like the MAP program that provide healthcare coverage for low-income residents in different counties. And they are based on income levels, and how we are able to measure and determine income levels are influenced by those legislative guidelines. I don't know. I mean, we would have to go back and look at the statute to determine exactly what those limits are, but it is a good question. And, I think that we are often looking at the different guidelines to try to reduce barriers, but within the legislative boundaries that are set for us. But that is a good question.
Thank you, Monica. We do have another question from a community member asking or stating that they need access, not just to healthcare, not just access, I should say, but access to qualified medical care. Asking how did we decide who was going to run the clinic? And I believe she's probably referring to Hornsby Bend and or Del Valley. Mike, did you want to? So I think the question is, how did we decide who's going to run the two new clinics, Del Valley and Hornsby Bend?
First, we start with our partnerships that we have, and principally with community care health centers, and they're one of the largest FQHCs, federally qualified health centers,
in the state, and they also provide primary care for the largest portion of the MAP program members. And I think, to starting with that and then moving to maybe some of the on-site clinical management and how that's done, really we need to defer to those that are actually operating the clinic to best determine, okay, what's the best fit here for the community? And so I'm answering this in very, very general terms because there's a lot of nuances that probably go into that. But I don't know if any of other Central Health colleagues have anything to add to that.
And Lorena, if you have more specific questions, please reach out to us. We're always happy to assist and get you more information if you need that. I'd like to circle back. I am monitoring for more questions from the community. But Will, I wanted to circle back with you regarding voice of the community, and we have put this out in a public, a press release. But I know there have been some themes or trends regarding barriers to care, and I just wanted to ask you if you might want to quickly recap some of the barriers that you've already been gathering and the themes, I should say. But I'd also like to ask you, and this may be for you or Monica or JP or Mike or anyone, any surprises based on what you're hearing from residents regarding what might be preventing them from accessing care? And I know the report's not complete, but we have been gathering themes and we've actually shared some of those themes publicly.
So Ted, it's been a great process in hearing from the community. And as we hear from the community, there are some things that we have heard. One of those things is transportation, just to and from different facilities, the need for additional help to get to and from facilities, especially for older patients, access to information in the community is something that is beginning to bubble up quite a bit. And the idea of partnering with Central Health in some ways to create workshops and different activities that would help people get more information that would help them better manage their healthcare. Those are some key things that have come out that are really important. And then one of the things we've noticed just across communities that there are different unique chronic disease issues that Central Health could easily address. Just knowing that the information is needed and how they want it. There was also the mention of partnering again with like community organizations as well as churches to help provide access, sort of like Sunrise Church does, and also information that can better help the community where they are. And so those are things that are really important in the study that I think will be helpful. There are some service-based responses that we're working through now just to make sure that the quality of service, timing of scheduling, and patient wait times are exactly in alignment with quality healthcare service. And so those are all things that are being considered and have been mentioned throughout the process of hearing from the community in Travis County.
Thank you, Will. I appreciate that insight. I have a question, and Monica, I think would circle back to you regarding timeline. And this did come up at our luncheon that we had at the Central Health Southeast Health and Wellness Center. I think the people that we serve are anxious to see results. And somebody had asked me, would this be done by January? And so could you go back and revisit and just explain that this is a long-term process, but maybe give people just an overview of just the timeline. So, we're going to see a strategic plan draft early 2022, but maybe explain that this isn't a 1, 3, 12-month process, but a multi-year process.
Yes, and thank you, Ted, for bringing that up. And it also is not just a single track process. So we already have, we started this process last year. And in addition to laying the groundwork for this longer service delivery, equity-focused, broader strategic planning process that is ongoing, there was a parallel process that included identifying, in addition to the filling the needs in Hornsby Bend, Del
Right.
Valley, and Colony Park that have always been prioritized and remain prioritized until they're delivered. There's an additional parallel process for clinical service delivery initiatives that came out of the second phase of this work, as we're calling it, that identified immediate service delivery priorities that are being undertaken right now, that include areas like clinical education for people with chronic kidney disease, expanding services for people experiencing homelessness, and expanding substance use disorder services, in addition to some specialty care service expansions, and establishing outpatient dialysis services, which is something that has never been available for the population that we serve in Travis County, that is going to come online this year. So there are immediate priorities that are being identified, as well as this longer term process. So the identification of the longer term service delivery strategic plan is going to continue into early calendar year 2022, which will bring this to the board in the first quarter of 2022. And then we'll immediately go into an additional ongoing planning cycle that helps us both identify our next immediate service delivery goals for fiscal year 2023, as well as start coming up with sustainable, measurable, and achievable work plans for larger multi-year projects that will take multiple years to achieve, and in a sustainable way that we can measure progress towards both our 1-year immediate projects, our 2- and 3-year multi-year projects, and then longer term 5- and 7-year projects. And as we work on the immediate, on all of the levels of this kind of ongoing planning exercise, we'll be coming back to the community, particularly as we're coming up with implementation plans, because as we're developing implementation plans for these programs to really be effective, they need to be informed by the communities that will be served by them. So we're going to keep coming back.
That's a really good point, that the community engagement process continues forever. It's not a finite process where we say we've done that, now we can move on. So that's a really great point, Monica. I know we are at the end of our time. I wanted to give Mike Giesland, our president and CEO, an opportunity to provide final thoughts. And as he does, before he does that, just a reminder, if you have questions, we may have one that we didn't get to. We will answer those questions. We'll post them on Facebook Live, and we'll share all of the questions and answers with everybody who's part of this this meeting, this conversation today. And with that, Mike, I would just like to turn it over to you for final thoughts.
Thank you very much, Ted. First, I'd like to circle back to the previous question that was posted on the Facebook to address how do you decide who operates those clinics? As those new health and wellness center sites, the construction commences, and then at some point within that process, we'll look, with our provider partners as to what the staffing looks like. And even in light of the staffing challenges that this nation is facing in the health and wellness and healthcare and medical space, we certainly want to come back to the community and have some more conversations about what that staffing situation looks like in each one of those health and wellness centers. And so there's going to be opportunities to engage in that process so that the individuals that are going to be managing and operating and working in those centers have the opportunity, again, to hear those community voices and those individuals that will seek care in those health and wellness centers. So, voice of the community. We're fortunate here at Central Health because when we've been able to build on prior year work to really focus on the health disparities and the gaps in healthcare that exacerbate those disparities, but also look at this through different lenses, for example, geography. So JP walked us through what's happening with the growth of poverty throughout Travis County and some of the planning regions. But we've also been able to look at this from the standpoint of what disease is a burden to an individual, whether it's diabetes or hypertension, and really focus on what is it that we need to do this year, the next year, and the next years after that to be able to zero in on that and improve that quality of life so that people can live the healthiest life possible. That is, attain health equity. And while we're fortunate that we have maps and data and subject matter experts and provider experts, these voices, they validate, what you say helps us to make sure that we're headed in the right direction, but it also adds a human context, which is also important when we're making decisions that affect people's lives. And whether it's go to work or dance at the family wedding, whatever is important to you is the system that we need to put together so that you can live the healthiest life possible, so that you can do what is important for you and your family and in your community. Will, we are so thankful to be able to partner with Case Strategies. It's just amazing. I'm thankful with the outreach staff and all the great thinkers in the community that are helping us shape and form this. So thank you all very much.
Thank you, Mike. And thank you again for everybody who took time out of your very busy week and during this holiday season to join us. We are grateful for your attention and your time. I do want to remind you that we have this presentation will be provided in Spanish at 1 o'clock. And so we invite you to join us then if you can. And again, thank you so much for your time, and we look forward to continuing this conversation. Thanks to all our presenters. Everybody have a good afternoon.